All right. Well, Robin, do you want to kick things off?
Sure, I'll get started and run over some of the housekeeping and a little overview of National RTAP, and then we'll get into the heart of the matter with Al. Uh, Thanks, Al, for putting all of this together, and thanks everyone for being here. Uh, I am very happy that we're having this great discussion. We loved the Community Rides Grants Round One, and they were super successful around helping people take the next step in their partnership. And so we're really interested in continuing that work and helping build resources for partnership and connecting communities. So, next slide. So for those of you who don't know about National RTAP, we are a fully funded technical assistance center through the Federal Transit Administration. We just signed a new 5-year contract, so we'll probably be here for the foreseeable future, which sometimes 5 years seems like not foreseeable, but we're planning on being here, and we are funded by a set aside that comes off the 5311 program. And we are focused on providing technical assistance to 5311 grantees, subgrantees, or entities eligible for that. That's general public transportation, intercity transportation, tribal transportation, and then the state RTAP program is also a set aside from 5311. We provide free materials, free training. We're here to help do your driver training or answer questions or help you understand things that you're running into, find out if there's other transits who are facing the same challenges, and look for ways to maximize the value that you bring to your community and help them see that value. Next slide. So we have training, which is our manuals and our e-learning. You can send for them. Information and best practices. This is one of the things that we're doing right here today, is sharing information about good projects, good ideas, good approaches, but also, we have toolkits and topic guides that help you get a feel for an area or an issue that maybe you've just run into. We have technology tools that can help smooth the process of managing your program, either by helping you with your procurement, cost allocating to help you understand what it costs to do the services that you provide, and I think help you set up for a good partnership. Make sure that your website and your customer facing information is together and assist you with meeting your NTD requirements with GTFS. And we have peer networking that we have available through roundtables, but also through Podio for state program managers, people who are organizations that are interested in intercity or mobility managers. We have forums to talk about issues on that you can join. And please call us and we can answer questions. We can help you understand or provide you information to help you understand federal guidance or federal rules. Next. The other thing about National RTAP is that we are focused. We have a review board that is 7 state DOTs and 8 transit managers, including a tribal transit manager. We usually have at least 2 tribal entities on the review board at any time. They bring a real different perspective to the table, and our program really is interested in helping all 5311 grantees benefit as much as they can from the grants and the resources they have. So please, today while you're on this Zoom, use the chat to ask questions, have Q&A question and answer with your fellow attendees, or ask us questions, and we'll keep track of those things on the during the webinar and answer questions at the end. Next.
This may be a good place I can transition from here, and then Robin and I will go back and forth throughout this presentation. But so we're really excited to be releasing the RFP for the next round of Community Rides Grant Program. My name is Al Benedict. I'm leading the technology tools at National RTAP, and I'll also be helping to oversee the Community Rides Grant Program. So quickly, just to give you a sense of today, we're going to go over, kind of provide an overview of the grants program, how to access the information, key dates, program summary. We'll give some local partner examples, some additional partner examples, and then the support that RTAP will provide throughout the project. And that support is really starting, today with this webinar and just the availability of the RTAP team. And then we'll provide a few examples of different project ideas. And then we'll break for question and answer. And then we'll convene again, and we'll hear from two of the past grantees. Ron Baumgart is going to talk about the River Cities Public Transit and their local partnership with the medical centers in South Dakota. And Pam Hernandez is going to talk about the local partnerships that the Rural Economic Assistance League created with the local community college and the assistance they offered, providing access to education for students. And then we'll end with another question and answer session. And so this is really, everyone's here, so you probably have seen this webpage, but this is the Community Rides Grant webpage, and this is really where everything, we'll keep this up to date. You can find the proposal, the RFP there. You can register for the second webinar, which is next week. And that one, we're going to dig into the application portal and also talk about some of the RTAP tools, the cost allocation calculator, and get into some performance measures for the proposals. You can sign up to be notified about grant programs. You can view resources. For example, we'll post this webinar to that website. And we'll also post the questions, the recording of this webinar, and we'll also post the questions that we receive today and next week. And there's a great resource. If you scroll to the bottom of that webpage, you can see the previous or the past Community Rides Grant project awardees. And just to give you a sense of some of the ideas that have been launched before, and in each of there's a map that you can see where they are, across the U.S. And then each of the projects has a final report and a webinar or a presentation that you can look at. So just to give you some more ideas on project ideas. And if you have any questions and to be alerted for updates, you can email grants@nationalrtap.org. So the key dates, this is actually on the Community Rides Grant webpage, but we released the RFP early July. We're all here today for this informational webinar to give an overview of the grants program and to talk about local partnerships. And then next week, the grant application portal opens, and we will, on that same day, we'll have our second webinar, and we'll kind of give a little tutorial on how to use it. And then again, some of the other tools that RTAP has that could be helpful with this proposal and the projects. The applications are due end of August, and we're hoping to make the decision, August 24th is listed, but mid-October to select the grantees. And then starting at that time, November and December, we'll work with those projects to project readiness so that they're ready to go on the first of the year in 2026 when this work officially begins. And the project is a year, up to a year, depending on the scope and the scale of the project. It might not be a full year, but a maximum of a year. And so the projects will be completed next year in December, and then the final reports are due in March. So we have $250,000 to be distributed this year, but this is an annual project. So there'll be other opportunities for subsequent rounds of funding. And we also have additional resources that are specific to tribal projects, and we're working on that now. And we'll have that information in the coming weeks, and we'll make that available. But there's a separate pot of money for tribal projects. And then the grant awards can be up to 100,000, but a minimum of 25,000. And again, that depends on the size and the scale of the project, and how big it is, and also the timing of how long the project would be. Those funds will be distributed monthly based on time spent on the project and additional expenses, and you would invoice RTAP, and we would reimburse you over the course of the project duration, up to the 12 months. And the RFP kind of the project itself, the projects themselves can be very flexible, really aimed at supporting local partnerships to really build transportation solutions that meet the needs of the community. But what's not eligible is our vehicle purchases or expenses for existing transit services. And the RFP also outlines some of the other requirements, but that's one thing that we wanted to note. So supporting local partnerships. There's these graphics here to the right. Those are actually, we're going to learn about those projects today. That's the Rides to Wellness for the River Cities Public Transit, and then the Color Express. That's the local partnership with the community college. You must have a minimum of one local partner, and that could be a memorandum of understanding or a letter of commitment. But that local partnership should really be aimed at addressing critical needs that your community faces, like access to healthcare or employment, education, or healthy foods and social services. These are just some examples, but really, the projects themselves should be tied to local transportation plans. And if it's not, then how can that be incorporated into the plan? Because these aren't really aimed at being one-off solutions, but really tying back to the health of the community, the whole community, filling gaps, or perhaps looking at duplicative services that might be in a community. How can these transportation solutions really have the biggest impact? So we talked about linking these to the community, but they should also be scaled to the rural environment. So for example, here's it's in rural areas, and all rural areas are different, and every community is unique, but there's some common themes or challenges that rural areas have in terms of providing transportation access, and those in part driven by the distances that span health, where someone might live, and access to healthcare or access to a drug recovery center. And so the solution should be scaled to that rural environment, and it should be innovative. It doesn't mean that it's never been tried before, but what unique aspect is your project bringing to the table? And maybe it's a solution that was tried in an urban area. How does that translate to that rural environment? And also replicable. We really want to take, the idea here is to learn from the handful of projects that are selected through this round of grant funding, but then share those lessons learned beyond those, the grantees themselves, to really see some of these solutions tried elsewhere in rural areas across the country. And then sustainable, that's, financial sustainability is really important. Again, these aren't one-off solutions, but how is that project going to live on beyond that year of funding, or up to year of funding, I should say. So we kind of touched on this, some of the different local partnership ideas, but so this list is very similar to the previous slide, but here are some local partner examples. Employers, healthcare providers, drug recovery centers, or for example, the opioid crisis. Again, these aren't issues that are exclusive to rural areas, but oftentimes, given the distances and the lower density, they do pose unique challenges to rural areas to provide these services. So how can this program help get you started to really plan and implement these solutions that are really tied to the holistic, your community as a whole, and to really improve transportation access. And so and these might, they could perhaps be intercity connections as well. A lot of times the healthcare providers might not be in the same county or the same city that where someone lives in a rural context. So while the local partnerships are required, this isn't required, but we do encourage you to take a look at some opportunities for additional collaboration, or even in some cases funding opportunities. For example, the Coordinating Council on Access and Mobility, CCAMP, they have a program inventory for non-DOT federal programs that fund human service transportation. And it's a long list. I believe there's 130 organizations or agencies. But in many cases, these same agencies might actually be operating in your community already, and you might not be aware of it, or there might be an opportunity to collaborate, or perhaps there's some additional funding that can be brought to your project. So we encourage you to look at the CCAMP program inventory. And in addition to those federal partnerships, state DOTs, for example, regional transportation planning organizations, these are state DOTs. Maybe just pick up on that a moment. We just released a case study on the ride sheet scheduling platform for smaller to really help smaller rural agencies with their scheduling and operations, and to help provide some technology. That case study, so the first half talks about Kansas and the success that they've had implementing RideSheet, but then the second half talks about state DOTs and the role that gives some ideas on how they can also support technology and transportation solutions at that local level. So encourage you to take a look at that. And then there's USDA, for example, access to healthy food, health and human services. And then there's that rural community opioid response program. Again, these aren't necessarily issues that are unique to rural areas, but in some cases, just the distance that spans and the lower density does create these unique challenges, but also opportunities to provide transportation solutions to really meet the community need. And then the National Association of Development Organizations, NATO, could also be another opportunity to collaborate. So the RTAP staff, so I kind of touched on this already, but so it's not a funding and we'll see you in a year. We really want to work with everyone, and that's starting now really with the Community Rides Grant webpage that we created and the resources that are available there, these webinars that we're hosting, but then also once the projects are selected, we're going to work with the grantees to really work on project readiness, so they're ready to go January 2026. And another thing that is widely successful, the first round, were the peer network. So monthly meetings we will hold with the grantees to really talk about the projects and share lessons learned and work through challenges collectively and create this collaborative network for rural agencies to really work with their peers essentially. And we'll invite the past grantees to those meetings, depending on the topic or the challenges that agencies might be experiencing at a given time of the projects. And those are, that opportunity is really, we see that as just a great opportunity just for rural agencies to work together, because in many cases, or in some cases, just the nature of rural areas, they may be working in isolation, and so just providing that framework to collaborate is really a key piece to this project. And we'll be sharing the lessons learned. I mentioned this earlier, but beyond the grantees here that we're working with, but really to, at the end of the project and throughout, but really to, we want to see these projects, how they might be replicable in other communities across the U.S. And we'll also work with the non-selected projects to build project readiness and work through maybe technical issues or thinking through local partnerships so that perhaps the next round of community grants funding, they are ready and or maybe there's other opportunities for funding that might be available at that time as well. So these are some potential project ideas. And so I won't go through all these because we really want to hear from you and your communities and the unique needs that it has. But really, thinking, and then the RFP itself also offers some other ideas, but really ranging from volunteer transportation network services to mobility managers and the role they can play in helping riders and coordinate services across within a mobility management region or across the state as well. Using technology for trip planning perhaps, or it's really open, and that's part of the I think one of the great things about this program is that it is open and it's really aimed at that local level and supporting those local partnerships. So those are the slides I have. Robin, did you want to add anything before we jump into the questions?
No, this is great. The resources that are available are going to be annual. So we're looking at we may we'll be looking at opportunities for bringing more grant resources to the table as well. So we're looking at this as the launching of the program rather than a discrete, you put in an application. If we will fund as many as we can, and then we will be supporting the reselection or the opportunity for that project to be selected in the following year.
That's great. Yeah, so this is the begin. It's as Robin mentioned, we see this as the beginning to the program, and this isn't the end. So we do hope to have future rounds and future opportunities to invest in local communities, local rural communities. So now we are in the first sort of round of questions. And so before we get into the presentations from our guest speakers and past grantee awardees, there was one question that was submitted, and we will keep an eye on the Q&A and see if and we'll address this round now. And again, if there's questions, we'll post all these to the Community Rides Grant webpage, and if there's questions that we don't have the answer right now, we will work hard to get that, and we will update that resource on the website. But the first is how is rural defined? And it's really any agency that receives or is eligible for 5311 funding. And we link to a couple sources here for additional information, but the rural area, the definition listed on the 5311 Formula Grants website is really providing capital, planning, and operating assistance to states to support public transportation in rural areas with population of less than 50,000. And there's another resource that I encourage everyone to take a look at. That's the latest circular that was published in November of 2024. And that offers additional details on, in addition to what's in the RFP, but rural and definitions of rural areas, but then also just different funding parameters for 5311 agencies. I'm looking at the first question. I think you did answer this already. So yeah, that's right. Approximately 250,000 will be available for this round. And again, we do hope to have you know additional funding and additional rounds of funding in the future. And so if we and the funding amount, so 100,000 is the maximum. The minimum is 25,000. And so the you know we'd like to fund as much as we as many projects as we can. And so there'll be probably a range of maybe one or two of the, and this is with we'll see what the proposals look like. But for example, uh, a couple of the more maximum funded amounts. But then we'd also like it's also open to we'd like to see if there's opportunities to fund some smaller projects too. At a $50,000 award, for example, just answering one of the questions in the Q&A. Are there more unallowable expenses than vehicles and existing transit services? I would, in the RFP, those are the big ones. And the RFP kind of lists some of the other eligibility criteria. But those are really, and so I believe, and we will post this in the website, the answers, but I believe as long as you're meeting the other requirements for the RFP that's outlined in it, and there's different sections within the RFP from providing an overview to the, to what the requirements are, and then also there's a section on the review criteria. And so I would encourage everyone to kind of really read that closely, and we'll provide more information on the posted questions. But as long as you're meeting the other requirements in the RFP, but again, the two big ones for expenses that aren't allowed are vehicle purchases and existing transit services. And a link to this webinar will be available. We're recording it. I'm looking at the record button now, and it's working. And so it will be made available on the Community Rides Grant webpage, again, along with the questions. And the total funding is nationwide. And so this first round would be that 250,000 approximately, and then subsequent round of funding. If more funding becomes available, we'd love to select more projects. And then marketing projects, I believe they are. We did fund a marketing project, and Robin, this is where maybe you can offer some maybe a few details. But the first round there was a marketing project, and so it was eligible.
Yeah, we had in Tennessee, we had a transportation area that I think did some rebranding and redoing their materials, but they also utilized got their GTFS started and implemented and set up trip planning. And one of the things that many people who are doing the reporting for NTD with GTFS are missing the opportunity to connect with a trip planner and really provide door-to-door itineraries for the customers. So we're interested. I think also Benzie Bus was basically in Michigan. I think they were a branding program and marketing. So yeah, that's an eligible expense for 5311, and it's not capital, and it is to support ongoing and development and support of the organization. I think looking for ways to invite more of the community to use your services is an important part of having the service.
Yeah, that's great. Thanks, Robin. So it looks like we are caught up on the first round of questions. And so again, we'll break now to kind of learn about some of the two of the past funded projects. And And then we'll come back to another round of questions at the end if these presentations maybe they have sparked some additional thoughts. And so I'd like to introduce our guest speakers. We have Ron from River Cities Public Transit, and he's going to talk about the Health to Wellness program. And then Pam Hernandez is the mobility manager, manager of mobility management services in Rural Economic Assistance League. And I think Ron's slides are first. So, and just when you're ready, just next, and I can advance for you. And,
I think we're ready to go, Al.
okay.
Thank you very much for allowing us to share our story, and appreciate the invitation from National RTAP to be able to do that. I do have with me today Chuck Quinn, who works with us here to sort of monitor and do some of the reporting on the different specialized grants we receive. And so if we get into some questions I can't answer, I think he'll be able to.
I won't be able to answer them either.
So our Rise to Wellness grant basically stemmed from a grant that we'd received, Integrated Mobility Innovation Grant, IMI grant, where we worked with our local Avera Hospital. That's sort of a regional hospital. We're right in the center of the state of South Dakota with a lot of rural areas, several Native American reservations surrounding that area. And they realized that, you know, many people weren't making their appointments, weren't making their second appointments or therapy or treatments because they didn't have rides and didn't know how to basically access them. So when we got the Rise to Wellness grant, our focus was basically to develop a phone app / website. So individuals have the ease of scheduling rides and you know, basically could do that and make sure they knew how. We also then worked with the medical profession to train them on the app and access our website as well to schedule those rides. In other words, a caseworker or the person scheduling the ride, we trained them, you know, possibly ask, do they need a ride? Do they have transportation? And if they didn't, it was automatically set up and they received the confirmation and we furnished the ride. So this provided a lot of non-emergency medical rides where possible. It allowed us to the funding, some of what we spent for the actual rides was to cover, we have a highly rural veterans grant that 35 counties in the state of South Dakota basically are eligible for, and some counties aren't because their population is a little high. So we're able to use some of those funds to cover veterans rides in counties that didn't qualify. Some of the other things that we did, we grew our partnership past Avera and Pierre to medical centers in the northeastern part of the state, which included additional reservation, and so that just really grew it. They had the same software we had, so we were able to use our app and website to access those rides as well. So, and then we grew up to the Urban Indian Health Services, and that was really a big win and provided much needed transportation from the different reservations to you know, medical centers that were maybe not on the reservation, so the local public transit maybe didn't cover that trip or whatever. So all in all, it was just a really this really boosted our other IMI grant by allowing us to finish up our software that now is, I mean, it's still used, and it used more now than probably when we first started as our ridership. Our riders realize they can use it, the ease of it. They can schedule their own ride, put their own times in. The clinics are using it. You know, healthcare veterans Hospitals are also using it. Caseworkers are just flat scheduling the rides and we send a confirmation, we can get it done and just maybe a day or two prior to the ride, we make sure that that individual still got their appointment or whatever. But it's, some of the things we monitored was the cost of missing medical appointments and what that did for healthcare providers as far as losing some of their Medicaid funds and other things, because they do score all of that. And we learned that this program really did increase the, you might say, the return patient to their appointments and did cut down on no-shows and things. So we certainly felt that it was very successful. The funds that we got from RTAP certainly helped us achieve that and spread this. Basically what we're looking at is, you know, can we spread this statewide, and then, you know, in the future, can other states do similar things with their software, and probably already are, but in some cases, but it's been very, very successful, and we're fortunate that how we invested this money, it's basically the money spent, but we're still able to use the products that were basically developed, and the training that we trained medical profession peoples and clinics, that all sort of seems to remain well. Obviously there's some turnover, but enough people retain that it seems to be working well for us. Chuck, anything from you?
No, I'm part of in addition to developing the app, we wanted to, obviously, if you have the app, how do people come to the app or find out about how to use it? So we needed to train the professionals at the various clinics and hospitals. And so we actually worked with the nurses and the social workers and the case managers, the counselors, the receptionists. We taught them how to download the app and utilize the app, so they in turn could teach the patients that come to those respective clinics. And that seemed to be a really good model. And of course, Ron said, obviously you have some turnover, but we go back and do some refresher courses and for the new folks. And then of course, they get excited about it when it works well, and they talk to other medical providers, and pretty soon you're getting additional calls that some other group wants to expand or wants to start it. So it's been real positive for us.
Well, that's great. Well, well, thank you for sharing. It's a really interesting project, and you know, it's great how you were able to use the Community Rides Grant Program funding to kind of help support your project. You know, that was able to draw from additional funding as well. Finding that unique piece where the community rides could really help move things forward. So if you have anything else that you want to mention, otherwise I'll turn it over to Pam to talk about the Color Express.
I think we're done for now unless there's questions. Thank you.
Thanks, Ron. Thanks, Chuck. Pam, there you go. Thanks. I'm gonna move to your
Hi.
slide. There you go.
Well, good afternoon, everyone. Can you hear me?
It's a little quiet,
Is it a little
but
quiet?
we can hear. We can hear you.
Okay. I'll talk a little bit louder. Good afternoon, everyone. My name is Pam Hernandez. I am with Riel. I want to first thank everyone who is on the line. I see we have about 68, close to 70 attendees. So how exciting that we can share our stories with you. I want to congratulate River City's public transit on a job well done. So I'm honored to be here with you today to share our success story. Before I do that, I want to go ahead and ask you, I want you to think, have you or someone that you worked with, have you ever faced a transportation barrier in your program? We have. We have gotten calls for students that maybe you're having difficulty hearing me.
I wonder if Pam, maybe like when we first we're doing the kind of the not quite practice session. I could hear you
Yes,
great then.
I'm gonna
Um,
switch out to my other earphones. Give me 1 second. I
Okay.
apologize for this delay.
Okay, can you hear me now?
That's great. Yep.
Okay, 1 second. Can you hear me now?
Yep, I can hear you.
Okay,
Yeah.
perfect. I apologize for that.
Oh, that's
1
okay. Thank
second.
you.
Okay. So a little bit about Real. We were funded back in 1972, and we are a rural public transportation provider. We are a political subdivision of the state of Texas. We are located in South Texas. We're headquartered here in Alice, which is about 45 minutes west of Corpus Christi, Texas, right on the Gulf Coast. And we service 9 counties in the coastal bend. Overall, our goal here at Real is to deliver a dignified quality of life for rural communities in South Texas. Again, we serve 9 counties, and we have 5 transportation hubs throughout our 9 county service area. So when we had the opportunity to be a grantee recipient, our project goals for Color Express were to develop and strengthen transportation partnership that would help reduce transportation as a barrier in accessing higher education by residents of the rural communities of the coastal bend. With this, we wanted to increase awareness of public transportation services for residents in the rural communities as well, and establish flexible routing to educational institutions that would overall improve the availability, the efficiency, and the sustainability of transit services to and from higher education. This gave us the opportunity also to integrate new technologies that would facilitate improved efficiency of transit operations to increase and improve our services. And this is where we came up with the Color Express. Some of the highlights of our program that we did was what we wanted to do was secure the partners with the partnerships with the colleges, the universities, and the school districts, and developing those working opportunities with the school principals and the counselors, engaging in with the transit partners in our service area as well. And let me tell you, outreach. We did community coalitions. We worked with community activities. Anytime that a college, a tech school would be having signups, registration, they let us be part of that. And so we were able to get the news out about Color Express. The phenomenal thing about this program was that it offered free transportation for students, round trip to get picked up at home and to be taken to their college, university, trying to get students to a higher education without the barrier of not having the funding, the money for transportation. There would be times where we would receive calls and students were asking, how much would it be for me to travel from, let's just say, for instance, Alice to Corpus Christi? And so when we would tell them the amount of money, they were thinking, how am I going to afford that? This system, this program, Color Express, broke that barrier. And so it was such an amazing opportunity that we were able to give to these students throughout the 9 counties. In this also, we did travel training. Our mobility management team that I oversee, we did travel training for high school students, also students that maybe had special needs and that were going to be transitioning out of high school and transferring maybe to a community college or to a 4-year university. Next slide, please. Thank you. And doing this, not only outreach as far as being out at the university, but with social media, with making those relations with the news in our coverage areas, we were able to have segments dedicated to us. It was great. And still to this day, we still have those working relationships with our media outlets here in our community, our service area. And so they continue to help us get the word out about our public transportation for the 9 counties that we serve. We also targeted high school students and high school counselors that were possibly students that were enrolled in dual enrollment programs here in South Texas. Those are called Roll Upward Bound and TRIO programs, amazing programs that help so many students. Another thing that we did as well was we equipped our fleet with onboard Wi-Fi, breaking another barrier for students that maybe needed to complete an assignment or maybe do a test or whatever it may be, get something done on the way to school. So they were able to utilize that travel time in getting things done. Again, connecting with the community, it gave us, that availability to go ahead and get that word out. We helped so many students. It was great. I will tell you that the highlights from our grant experience working with National RTAP on this Community Rights Grant, it gave us access to valuable resources. We received materials, guides, support documents that help strengthen our programs and our outreach. The technology tools that RTAP provided for us, it gave us ability to gain access to software, platforms, and the digital tools that improved our efficiency and our impact. It made such a difference. The peer network meetings, I looked forward to my monthly roundtable meetings with Karen. And Karen, I know you're on this call and I want to tell you thank you. And thank you, Robin. I looked forward to seeing you guys. And by the time we were done, we knew our children's names and where we were going for vacation. You established that working relationship with them, and you look forward to working with them, and they were a pleasure. And so now I'm honored to call them colleagues of mine. It was a great opportunity. It was a great way to share ideas, challenges, and successes. Again, the monthly support sessions, it's fostering that collaboration and continuous learning. The shared earnings modeled, engaged in shared opportunities, and it helped us sustain our efforts and expand our reach. I'm glad to say that we were able to sustain a working relationship in helping students get to one of the institutes that was working together with us when we were doing Color Express. And so that working relationship and that partnership still remains as of today. Some of the colleges that we were working with, because of change in leadership, unfortunately, we were not, but we're not giving up. We're still in talks with them. So fingers crossed that maybe there might be something that we can do so we can go ahead and continue with this transportation, with assisting them. I have to tell you, the professional development, the opportunities that it came for training and skill building, not only did it benefit myself, but also my team and the organization for Real Transportation. It brought us such a great opportunity that we were able to share with so many residents of the coastal bend. And we still get calls asking for Color Express, and the program has been in it now for some time. That right there alone tells you the community impact that the Community Rights Grant helped us make a measurable difference in our community. And we're so excited for you that you are going to have this opportunity to do the same for your community. We changed lives through this access. We made a real difference in students' lives by providing the free transportation to higher education opportunities. We removed barriers and we opened doors. We also built Bridges to the Future. This grant gave us the chance, like I said, to build a lasting partnership with the colleges and the technical schools, creating the pathways and continued growth for collaboration. And with the support of this grant, we just didn't serve, we connected, we empowered, and we inspired. Sustainability, you've got to do it and make those working relationships and just know. And I'm going to close with this. This grant was more than a funding. It was a lifeline for a lot of people. It allowed us to say yes to students who thought that higher education was out of reach. We watched young people step into college campuses for the first time, full of hope because we could get them there. We built bridges, not just to schools, but to futures filled with possibility. And along the way, we found partners, mentors, and community that believed in our mission. We changed lives, including ours. And now it's your turn to carry that torch forward. I want to thank National RTAP for letting Real have the opportunity to share their amazing experience with the Color Express. And we want to wish all of you the best of luck. And just know that you can always reach out to me for any kind of guidance or assistance that I can provide. And I want to wish all of you the best of luck. And to Al, Robin, and to Karen, I want to tell you thank you on behalf of myself and Real. Thank you so much.
Thank you, Pam. That's great. So there's a one final slide that I hadn't shown. So we are ready for the next round of questions. I've been keeping an eye on the Q&A. There's none that have come in yet, but if there are, please, if that spurred any additional questions, please use the Q&A. And we will be meeting again, like I say, next week for another webinar. And so in that webinar, we'll be getting into more of the details of really using the application portal and as well as the cost allocation tool, just really touching on that, but just to make people aware of that tool and how that can help to look at the operational costs for transit service and a range of services from fixed route to demand response. So with no other questions, let me just see, maybe another one came in. Oh, we do have a question for Ron for the rides to wellness. Where did you find the drivers who provided the rides? Were they paid or volunteers? I don't know if you have if you're able to address that, Ron.
Our drivers were all paid drivers. We did have a volunteer program with a Vera earlier on, and when COVID hit, that sort of disappeared. So everything was paid drivers through our staff or through other transit agencies that we worked with, in this program.
Great. Thank you for that. And so here's with no other questions, we will I'll just quickly go over kind of a couple of the upcoming webinars that we are hosting. This Thursday, we are hosting a webinar on a Procurement Pro, which is a tool that RTAP manages, they've developed, really helping at some of the different federal requirements associated when you do issue a procurement. And then there's a state RTAP manager peer roundtable on the 29th. If you're interested in that, you can reach out to, I guess maybe information should be on the website. And then the second webinar next week, and then there's a book discussion on bus people, which I read that book, and it's an amazing book. It talks about somebody's 30-day sort of journey taking Greyhound across the U.S. And then, of course, we have our annual conference. It's in December. It's in Austin, Texas this year, Wrangling Access and Mobility in Rural and Tribal Transit. So I encourage everyone, again, more information is on our website. And this And here are just a couple of final emails or ways to get in touch with us. You know, the nationalrtap.org is our website, info for general questions. And my email is albenedict@nationalrtap, but I can be reached for this program through the grants@nationalrtap.org. Well, thank you. Robin, did you have any final thoughts or?
No, thanks. This is great. I appreciate people taking the time today to learn more about what the opportunity is. And we hope that you have projects that you're just waiting to take the next step on, and that we can help you take that next step. I think everyone that, everyone that worked on this webinar is really excited about and interested in looking at new approaches. And we look at helping build the community of people sharing their ideas. I think the rural transit people are the MacGyvers of transit. You take a lot of chewing gum, wax, and string, and you put together something that's really amazing. And I think that the innovations that happen in rural services are often a lot easier to scale up than the ones that large systems create that cost millions and millions of dollars in feasibility before they even get started. I think we do a lot of turn and burn, and that makes us innovation estuary. So thanks all for participating.
Yeah, thank you, everyone. And to Pam and Ron and Chuck, thank you for sharing your stories. And we hope to see you next week for the second webinar.